We now recognize the gentleman from California, Mr. Lieu, for 5 minutes.
Thank you, Mr. Chair. Thank you, Ms. Richards, for your testimony and the gracefulness in which you've answered the questions today. I want to also thank you for running an organization that has helped millions of women and men across America. And on behalf of the majority of women and men in this great nation, I want to say thank you. And having sat here for the last hour and a half, I feel like I'm in some sort of bizarre alternate universe. I think it's crazy we're having this hearing based on heavily edited videos and misleading videos that actually show the exact opposite of what was happening. And what was happening was that Planned Parenthood was following the law. I think it's also crazy that we're here when we have fetal tissue research that is not only entirely legal, but has bipartisan support. And I think it's insane that in my district now, because of these misleading videos, women have, in some cases, had to go through 2 sets of bomb-proof doors just to access health care. And I thank you for your courage, and I note the cowardliness of the maker of these videos who is too scared to come before us to testify. So let's just come back to reality for a few minutes. Abortion is legal in the United States of America. Isn't that correct, Ms. Richards?
It is correct.
And we don't live in a theocracy. The law of the land is not the Old Testament or the New Testament or the Quran or the Torah. The law of the land is the Constitution of the United States. Isn't that correct, Ms. Richards?
It's correct.
And abortion is a constitutional right. Isn't that correct?
Correct.
And Planned Parenthood allows women to access that constitutional right. Isn't that correct?
Yes, we do.
And none of that gets any federal funding. Isn't that correct?
That's correct, except in the very limited circumstances allowed by federal law.
Thank you. Now, there are multiple medical clinics across America that also provide abortion services, correct?
I'm sorry, could you repeat?
There are multiple medical clinics and hospitals
hospitals
across America that provide abortion services, correct?
Correct.
And they also provide services that have Medicaid reimbursement. Isn't that correct?
I believe that's correct, yes.
And no one is saying, let's shut down medical clinics and hospitals because they also happen to provide abortion services. Isn't that correct?
I don't think that's been
Right.
proposed.
In fact, they're going right after Planned Parenthood, even though you do the same thing as many of these medical clinics, because you actually, like any organization, have separate line items. That's not a new or novel concept, correct?
Correct.
Okay. So let's talk about fetal tissue research. It has made enormous life-saving changes for millions of Americans and people across the world. Isn't that correct?
That's right.
In fact, fetal tissue research has resulted directly in the development of the polio vaccine, vaccines for hepatitis A, rubella, chickenpox, shingles, and rabies. Anyone in America that has had a family member or themselves been affected by multiple sclerosis, ALS, and other central nervous system diseases, you can thank fetal tissue research for making advancements in that field. If anyone has been affected by age-related macular degeneration, by all sorts of cancer, by diabetes, by cardiovascular disease, by immune system issues, and by glaucoma, you can thank fetal tissue research for making advancements in those areas. It is crazy that we're here because the other side wants to shut down government because Planned Parenthood was following the law, because fetal tissue research is something that's helping lots of people, and now we want to shut down government because we want to defund all of that. That doesn't make any sense to me. And let me sort of conclude now by asking you to respond to sort of the questions about why there's been a reduction in cancer screenings. Isn't it true it's because guidelines have changed?
That's
They
correct.
said, let's do less mammograms. And then in terms of Medicaid reimbursements, guidelines changed there too about pap smears. Let's do less of those too. Isn't that correct?
That's correct, and we always follow the best science and the best medicine at Planned Parenthood.
And then let me read a quick letter from one of my constituents who saw that Planned Parenthood might get defunded. She said that she grew up in a small desert town, made some poor choices, ditched school at age 15, started having sex, and she didn't want to end up pregnant like a lot of young girls in my town, so she went to the one place that she knew would help her, Planned Parenthood. They made her feel comfortable. They gave her an exam, gave her birth control pills, told her that she had an STD, would need to take antibiotics.
Yep.
She says, without that, the STD could have made me permanently infertile. But because of what Planned Parenthood did, she corrected herself, graduated straight A's, and is now a medical doctor. And she thanks Planned Parenthood for helping her and her family.
I'm so pleased to hear that. Thanks for sharing that.